One of the highest levels of trust we have seen is that of the physician-patient relationship. Data has shown that this correlates to improved patient outcomes. Now, this is the Family Docs Podcast, and I'm your host, Dr. Rob Assibey, CAFP's District 8 Director, based out of Livermore, California. We have an episode today that is truly inspiring. Our very own social media champion, Dr. Alex McDonald, is joined by Dr. Todd Wolynn. Dr. Wolynn is the Executive Director of the Trusted Messenger Program, part of the public health nonprofit Public Good Projects. He's been a vaccine advocate for more than 30 years through his work as a clinical vaccine researcher, immunizing pediatrician, and immunization confidence and communication researcher. As you may know, the California Academy of Family Physicians chapter has developed a new strategic plan for 2025 to 2027. We focus one of our goals on being a champion of public health, health equity, and evidence-based medicine. A big part of our work in this current environment is building trust and focusing on evidence-based medicine. And I'm so glad these two were able to have this conversation. Let's get started. Alex, take it away.
Welcome, everyone, to today's podcast. I'm Alex McDonald. I am your outgoing CAFP president, although they've tried to get rid of me a couple times. I plan to stick around a little bit longer, so we'll see how long it takes. Today, we are going to talk about messaging, public health, and the role that we all have to play here within our communities, both locally as well as in the bigger scheme of things. And my guest today is Dr. Todd Wolynn, who is a pediatrician from Pennsylvania. So Dr. Wolynn, thanks for joining us.
Thanks very much. Thrilled to be joining you, Alex.
And Todd and I have done similar podcasts here for several times in several different formats. And so we apologize if this sounds redundant, but maybe it'll sink in eventually, or we'll do some greatest hits or something afterwards. So I want to take a step back and frame kind of why we're doing this work. So the board of directors of the California Academy of Family Physicians met this past November of 2024 and revamped our strategic goals. And these strategic goals really guide all the work that we do as an academy. The blessing and the curse of family doctors and primary care is so many different formats, so many different forms, so many different interests and areas and people and communities. And so the beauty and the challenge of primary care is we can't do all things, despite the fact that we want to do all things. And so the strategic goals really help us stay focused and stay on track. And so the four kind of strategic goals that we have as the Academy this year, or this 3 years, is advanced payment reform and system transformation, develop and diversify the family medicine workforce, support member wellness and joy in medicine. And fourthly, and kind of the most salient one for today's conversation, is champion public health, health equity, and evidence-based medicine. And that is really what we want to think about today, and how we communicate, how we talk to patients, how we talk to our colleagues, how we talk in person, virtually, social media, all the areas where we have these conversations, which could be a lot. And Todd here is doing some pretty amazing work here in this space, and we want to talk more about it. So that's the framework here for kind of why we're having this conversation, to think about how we can help doctors raise their voices, particularly family doctors, since this is the Family Doctor Podcast. How we help family physicians raise their voices and build trust and communicate with their patients. And that's really the linchpin here, given the environment that we exist in. So, Todd, why don't you kind of tell us a little bit about kind of your background and how you kind of got involved in this work and where you are at this point?
Yeah, so a board certified pediatrician for 30 years, though some of my good friends are family physicians. So I just want to get that out on the record.
I hope present companies included. I don't know.
Included.
Okay, good.
Yes. So 30 years. I was also a board certified lactation consultant for 25 years, all here in Pittsburgh, Pennsylvania, and had a chance to join preceptors of mine at a residency. They let me get involved in the administration of the practice. We grew it. I was the 11th employee in one office, and over that time, we grew it to 3 offices and over 100 employees and 20 providers. And did a lot of odd things, including building a regional breastfeeding center because we had so many lactation consultants that were also physicians, and PAs and NPs. But the weird thing in 2010 was we hired a full-time, brought on a communications director who went on to become full-time with us. His name is Chad Herman, and built out a full production studio, which we called Evidence-Based Studios. And that might sound kind of weird for an independent practice to have those things, but it's how much we believed in exactly what you talked about, which is trust and communication. That lots of people try and control narratives, but at the end of the day, data in the United States and throughout the world shows that people trust their local healthcare provider. So it's not necessarily like they may like the system and all, and it could be whatever, a Kaiser, or it could be a UPMC, or it could be a Cleveland Clinic, but they really want to hear what their local healthcare provider says. It's not like some web message from a big health system drives things the way that a message from their local practice or provider does.
Yeah, I think that's such a great point. And, most salient here is during the COVID-19 pandemic, when the vaccines were coming out, Kaiser Family Foundation put out a big study saying, who do you trust most to get your information regarding the COVID-19 vaccine? And at the top of the list was your physician, your healthcare person. And so that was top of the list, not way above anything else you can. The president, the CDC, your healthcare organization, your neighbor, your friend, your religious leader. And so really physicians remain one of the most trusted professions overall. I think nursing beats us by a little bit, but not
Correct.
by much. And then, members of Congress are like in like the single digits, but physicians' trust is like 70,
below
70
Sith Lord, below Sith Lord.
Yeah, but physicians are like 70+% when it comes to being trusted messenger, and more specifically, your physician, right?
Yep.
The one that you have a relationship with, and that's why the key of primary care and continuity is so important.
Yeah. And I would say that the data also supports the healthcare fields in general. All professions have taken a hit in trust. The healthcare professions, and as you said, led by nursing, still lead the pack. Pharmacists actually can be trusted messengers, as can nurses, medical assistants, mental health, or social workers, right? We all have a role to play, but absolutely positively, primary care providers have this longitudinal relationship that they build with their families that's unlike any other relationship. So, I served families over my 30 years. Some of those families I saw for the entire time, whether it was siblings or then those kids ended up having kids. And so, Alex knows this story very well, but in 2017, because I have done 14 years of clinical vaccine research. I had worked with vaccines in a variety of different ways. I had done a bunch of consulting, and was doing some work around the HPV vaccine, and recognizing that in 2017, 11 years after that vaccine came out in 2006, that the National Immunization Survey data showed that only 37% of girls 13 to 17 years of age were up to date with their HPV vaccine 11 years after, right? So that means literally a little over a third of these girls were going on to be protected against a virus that we know that causes really serious disease in terms of precancers, cancers, and death. And 37%. So we were doing something drastically wrong. And that inspired me to go back to my practice. I had drafted up a mini screenplay for a 90-second PSA and on the HPV called We Prevent Cancer. But here's the key. I took it to Chad, our communications director, and he did masterful editing, and we recognized the data showed the trust was between their healthcare provider and their patients. That could be docs, again, nurse practitioners, physician assistants in this case, when we were deciding to make this video. And so he stole a page out of the NFL domestic abuse campaign, where each of these players would get on and say, no more he's got a bad temper, no more he just got drunk. But we got on and said, hey, this virus only requires one time, one touch. We dispelled the myth that it required intercourse. We dispelled myths that that you needed to wait. Matter of fact, you shouldn't wait. You want to get this vaccine before you're ever exposed to the virus. So we talk in there about getting it between the ages of 9 to 12 to be on time. And so it did great. It resulted in behavior change, right? At the end of the day, Alex, in family medicine, in pediatrics, our main job now is behavior change. Car seats, seat belts, not using tobacco products, exercising more. So in this case, it was an immunization-oriented message, and it was quite effective.
No, I love that, and how, putting a communication specialist in your practice was such a unique piece. I don't know any other kind of small or solo practice that has done that. Now, I want you to also share with us kind of some of the downsides of that in terms of reaching out, and particularly when it comes to vaccines, and kind of how this evolved over time, because I think the next piece here is important to be aware of, and puts kind of your work in context. So tell us a little bit more about how the next steps, and then how you got more into the social media space and helping support other physicians.
So 15,000 views into that video. Things were going great, and people were making phone calls and celebrating how cool they thought the video was. 3 weeks after, this is 2017, pre-pandemic, a mom in the practice posted to her own Facebook, check out this video. How cool was my practice? And her sister-in-law, who was not supportive of vaccines, promptly took that post and dropped it into a Facebook group of 40,000 strong people who were not supportive of immunizations. And thus ensued a global coordinated attack online on our practice, on our Facebook page primarily. Yes, people still use Facebook. And this was 2017, and we were reaching the appropriate audience. Here's a question for you. 10,000 attacking posts on our Facebook page from over 800 accounts. We're in Pittsburgh, Pennsylvania, Alex. Gander, take a guess. How many of those attacking accounts came from Pittsburgh or Southwestern Pennsylvania?
I'm going to say like 5%.
Yeah, there was at the initial count, at least when we were counting those 800 attacking accounts, none of them were from Southwestern.
Oh, none. Well, all right.
Believe it or not. So we were already ringing the alarm bell, waving the red flag, and saying, "Holy heck!" By the way, 3 weeks after the post, it got picked up, but then it got put into this really well-oiled, sophisticated network that was global. And what we saw was that they had a system to then launch targeted attacks against what they viewed as an account worthy of attacking. And thus came the attack started in Ohio, but they went to Texas and California and Florida, and pretty much then almost made it to almost all the states. But New Zealand, Australia, Czech Republic, Ireland, it was funny because not only did they do attacking posts, but you can weaponize reviews systems. So we could shut off Facebook, but you couldn't shut off Yelp or Google. Thank goodness Yelp had a protocol to remove the fraudulent reviews, but Google didn't. And so we kept sending to Google. It took 3 months to figure out how to even try and get in touch with them. And we got a canned response showing like screen grabs of the woman from Sydney, Australia, who's giving a 1-star review. And I said, we're pretty sure she doesn't drive from Sydney, Australia to Pittsburgh to get her kids' ears checked. Bet this one's not. Probably not. And it's still, it took them 6 months of canned responses to only remove 2/3 of the fraudulent reviews. And it wasn't until we ended up going to the Guardian with those screen grabs and showing them the fraudulent reviews. They ran the news piece on it, and then magically the very next day, 344 days after the attack, Google took down the remaining fraudulent reviews. So
interesting.
So that is a possible negative outcome.
Right. Well, and let's take a step back here. So in this age of excessively easy access to information, you turn on Facebook or Twitter or Instagram or TikTok or Google or whatever you want. You can literally find any information to support or refute whatever your worldview is. We also live in these little echo chambers where kind of we reinforce each other's worldview, and there's hard to break into those. So let's talk about kind of the existing information environment that we live in right now, and then also tell us the difference between misinformation and disinformation, and because those terms are thrown around a lot, but I think it's important we kind of talk about those terms and clarify them.
Yeah. Well, let's start off with that. So misinformation people would describe as information that's erroneous, but not with a purpose, right? Somebody shares something, gets it not quite right, but it picks up and it's shared around, and it's misinformation, which is inaccurate information, but without an agenda. Whereas disinformation it will be described oftentimes as inaccurate information, but with a specific agenda to push a narrative that's not correct. It's important to recognize that humans are designed for threat. It's the reason why your uncle and your grandma send you, share posts or like posts of scary things, like why you need to travel in your car with one of those hammers that can break the window open because you're going to drive over a bridge with water and you have to have one of those, right? So it's the kind of things that evoke fear responses. Or on the other hand, are sensational, right? Or fantastical. If you put up a post today that said, 4 million people got this immunization and everybody did fine, that would give you a little blip and go away. But if you say, this medication is being given, but in that medication, there's snake venom, and government and pharma and doctors are all together in on this and trying to give you snake venom to harm you. That's scary and it's sensational, and algorithms will prize it and people will share and like it because it's just jumps out at you. I will point out, related to the situation we went through, if your message is resonating and it gets a lot of attention, it makes you somewhat of a target. But our choice was to take that post down, which is typically what they want you to do because they view you as, hey, we don't want your voice out there. And we know other groups, large health systems that have put out messages, and when they got attacked, they put it right down, or even large groups, and I'm talking about like quaternary billion-dollar healthcare systems that choose not to post for fear of being attacked. So we need to recognize who's controlling the narrative. So anyway, our communications director is like, oh, heck no. We want to get the word out there. And frankly, it's not our goal to be big 2 continents away. It's our goal to reach our patients in our region and our the area that you serve.
Right. Yeah, I think, and I know this sounds scary and is going to make people not want to engage and not want to communicate. But it's important to sort of face the reality of what's out there right now. And as I said before, we live in these little echo chambers that just we get all of our information from 1 or maybe 2 sources, and it further reinforces our worldview. But it's really important that we continue to speak up and to share our expertise and our medical professional opinion. We literally went to school for decades to be able to have these hard conversations with patients. And so, how does a family doctor, a pediatrician, a primary care physician, where do they start? How do they have these conversations without, overstepping or causing problems or getting attacked, quite frankly?
Here's the interesting thing. So first off, let's think about it. There's 2 real big platforms that we engage patients. One is face-to-face, live in person in an exam room or a clinic. And the other that I've been describing and that you and I have talked about a bit is using digital platforms. I think both are actually really important. But here's something that's really interesting. Healthcare providers actually aren't trained in communication. We're trained in diagnostics. We're trained in memorizing differential diagnoses. We're trained in critical evaluation of data, but we actually aren't particularly trained. And when I've asked people this, and the people think back, the only training that most people can think back, at least if they're on the medical school track or allopathic or osteopathic track to go into medicine, is maybe like a mock patient. Not like Kramer on Seinfeld, but it's like,
yes.
But like, it's just you have a patient in front of you and how to elicit a history, but it's not about how to talk to people. As a matter of fact, I think there's data showing that doctors tend to interrupt their patients within about 23 seconds. And it's interesting. You brought up 2 of your strategic initiatives, numbers 3 and 4. And 4 was about, champion public health, you said, and evidence-based medicine. But 3 was the joy, putting the joy back into medicine.
Yeah.
I think that anybody out there listening would say, I feel pressured, rushed. I have to see more patients. I have to document more in more detail. And before you know it, you're lucky that you can look up from your keyboard while you're trying to type and still see your patient. And most of us went into primary care because you wanted to talk to your patients and you wanted to figure out what's going on and you wanted to be able to express empathy. And what I would say is when you become better in communication, I think that puts some of the joy back. I think it empowers healthcare providers to be better communicators, but we're not trained. And frankly, when you're a better communicator, you empower patients because they feel heard, and it opens up additional layers of communication that allow you to make better diagnoses, to coordinate care more effectively. And so, to your question, what can we do? I think if we're playing the long game, and I think communication and factual information and evidence-based information, strategic points 3 and 4 are going to require us to change our curriculum. And this goes into medical school or pharmacy school or nursing school on just how to talk with other people, how to use active listening, how to make sure that people know we understand what they're telling us, while also kind of helping them with the agency that they have to get to an evidence-based health choice. So curriculum changes in medical school, but also residency and training programs all the way through their professional track. I had the great opportunity, Dr. Ben Hoffman, who's the immediate past president now of the American Academy of Pediatrics, and I saw him in Pittsburgh giving grand rounds and talking about the importance of advocacy in our professional development. And we don't get rewarded for this. We get rewarded for publications or how many patients we see, but talking about how now programs are recognizing advocacy, whether it's communication or whatever. And I think that really needs to be considered in the professional path for a family physician is, do we do media interviews, or are we working on improving our communication skills? So ways that we can do this. There are training and materials, and I'm sure AAFP has these. I know AAP does. I will tell you, in the program that I'm now executive director of, which came out of the experiences I've had over the last, 7, 8, 9 years, is about empowering healthcare providers with these types of trainings on how to be able to have these conversations, how to be able to listen, how to be able to, again, help people through this. So there's different methodologies. I'm going to give you one very quickly, if that's okay.
Please.
Yeah. And look, you've heard of multiple different modalities. Motivational interviewing is one. It has data behind it. It requires practice and support. Whatever methodologies that, practices or institutions choose to do, they should really continue to reinforce these skills. What I'm going to show you is just one, and it's not the only one. It's not the best one, but it's one that I was trained in that makes sense to me. It's called AIMS. So AIMS stands for AIMS. A is for announce, I is for inquire, M is for mirror, and S is for secure. So very quickly, if you were making the recommendation for immunizations, and you had an 11-year-old girl, her name is Sally Jones, and you say to Mrs. Jones, Sally looks great today, knowing how to make a presumptive recommendation, you would say, Sally's due for her TDAP, her HPV, and her meningitis. And Mrs. Jones might say, great, and you're done, and you say, terrific. Or Mrs. Jones may say, you know what, that first and that third one, that TDAP and the meninge, she needs that for school. I don't know, that HPV, I'm not sure about that one. Go to I, inquire. Mrs. Jones, you've been bringing Sally here for 11 years. Can you tell me a little bit more? What are you concerned about? So you've inquired, and she tells you, my sister posted on Instagram that's the one that she heard can sterilize kids. And then you can mirror those words back. So Mrs. Jones, I just want to make sure I have this straight, like that your sister-in-law posted on Instagram that the HPV vaccine can sterilize kids or cause, something like infertility. Is that right? She goes, yes. Yeah, that's exactly right. So rather than interrupting her to get to our next patient quickly, we've used active listening. She now knows we know what's scaring her. And now this allows me a few extra seconds to express some empathy and say, without magnifying the myth, and I can say, wow, if I thought that were true, that would scare the heck out of me. Can I tell you why I got this vaccine for my kids or my daughter or my niece or granddaughter or whatever? That little stepwise approach that I just showed you there is evidence-based. It's communication research-based, and it allows us to connect at a level that gets me over to the same side of the table as Mrs. Jones to just say, that's scary. I have some information that I'd love to share, as opposed to, Alex, the two things that healthcare providers do when they're not trained.
Right.
When you are not training, you say, hey, I'd recommend you take this medication. And they're like, I'm not so sure. The two things that healthcare providers knee-jerk tend to do is say, look, let me tell you, there was this great study that came out last year, and really good 95% confidence intervals. And they start talking away as if you're talking to another medical or healthcare expert, somebody who's got a lot of questions or concerns.
Yep. Just gloss over and just, yep.
Exactly. The second thing they do is talk about the scary stuff. Do you want to know what can happen if you don't take this medication? Your blood pressure could go, and then they start going into the fear-based tactics. If you respond to somebody's questioning, and questions are not bad, we should take time to answer questions. But if we respond to questions with fear or data right out of the gates without active listening and understanding what's going on and getting to a point where we can express some empathy to the reason they may be in that situation where they're confused or worried, then you're going to suffer the fate of, oh my gosh, they got really angry at me, or they just didn't want to talk any further. And I think that's part of the problem, Alex, is where we are now is people, healthcare providers, I think, get ready to walk into a room without any strategy. And they're like, I don't know that I want to deal with this. I don't want to talk about, I don't want to talk about an antihypertensive. I don't want to talk about a COVID vaccine. I don't want to talk about a smoking cessation, you name it, whatever. Like, it's just like, it's too much. And I would say that's an odd place for us to be, but I know why we're there. And it's because of all the noise that's out there. But I would never equivocate around, I don't know, do you want to put your kid in a car seat or not? Whatever you want to do. I wouldn't do that.
Right.
Right. I know that the data shows how important it is to put a kid in rear facing till 2 years of age.
Yeah, I think one of the biggest things that I love the kind of AIMS model, and again, it's simple and easy to use. We are scientists, we are data driven, but 99.9% of the people out there are anecdote driven. They're driven by stories and driven by emotions. And telling somebody about studies and reciting things to your blue in the face may impact us. It may incur when we're going to a grand rounds or reading an article. We're gonna understand that information and take that in, and that will impact our decision making. The vast majority of people make decisions based on emotions and stories, so I use a lot of storytelling when I'm communicating with patients. And the second piece is asking, why don't you want this HPV vaccine in your example, and then asking permission to share my perspective as your trusted doctor. I think those two pieces are so key. So understanding where they're coming from, and then asking permission. And that was a little shift that I started doing. I learned that from a colleague in, the mid-COVID pandemic. And I started using that one tiny piece, and it totally changed the dynamic of that patient-physician interaction. And it made it so much more enjoyable and so much more collaborative, which I think that's really the key. We want to collaborate with our patients. We don't want to tell them what to do, but we want to help give them good information to make the best decisions for themselves and their family.
And that's spot on, right? It's helping them to get to their own personal health decision that hopefully is evidence-based. The interesting thing is that, as you said, people love narrative, the power of storytelling. And again, good listening gets us a far way. But it's important, again, to recognize people want their healthcare providers' advice and guidance. They're in your office because they trust you, right? I mean,
right.
Their most vulnerable situation is their health, or even more vulnerable is their kids' health. And they're in there trusting you to do right. But let's be careful and recognize that there are outside forces, I think, trying to create a narrative around, oh, they're just trying to push this on you. They're trying to push weight loss drugs on you. They're trying to push immunizations on you. They're trying to push antihypertensives or cholesterol medications on you, right? But recognize that you've been treating a lot of these patients for multiple visits or multiple years. And so it's important for us not to get ourselves shoehorned into a situation by external narratives, but say, I just like when I took care of Sally's laceration 5 years ago, or her pneumonia 2 years ago, or even her little brother, Johnny, that, when we talked about car seats or sunscreen, everything I've ever done for your family has always been evidence-based, and it's nothing different than I do for my own kids. Everything I recommend, I do for my own kids and myself. And so to that point, I think you can help reframe and build upon that trust that we have, as long as people, again, don't feel interrupted, rushed, have no agency, or not asked, can I share something with you? To your point, these are all techniques, communication techniques, that are best practices in being able to open that relationship up and put the joy back into medicine too.
Yeah, no, I completely agree. I think it's a great great important piece that we all lose sight of amongst all the different clicks and check boxes and things that we all have to do in our days. But it makes it so much more enjoyable to see patients.
You know what I really enjoy? I love going to an event with other family doctors. Throw in some FM residents, sprinkle in some med students, and I'll be the first one to sign up. Literally, I'm usually the first one to sign up for these events, but I especially enjoy getting together with these other family docs who are passionate about learning, connecting, and networking with each other. Well, if you need your social battery recharged with some amazing family physicians, please sign up for this event. The Family Medicine POP event, that's POP for Prism of Practice, is happening September 5th through 7th, 2025 in the beautiful city of San Diego. You can find out more at www.familydoc.org/pop. That's POP. POP. I'll see you there.
Now, many of you out there know that, I use social media as well, and I think it's an important platform. That's where most patients spend, 20 minutes once or twice a year with their doctor versus they spend 2 hours per day on social media. And so as much as some of us don't want to, and we can all engage in our own way and with this communication, tell us your thoughts about physicians engaging on social media and using social media as a tool to communicate, not individually, but collectively with their patients.
Yeah, I myself had jumped pretty heavily into social media right around January 1st of 2020. That's when my daughter said, you should get a TikTok account. And so I did.
I want to see those dances.
Yeah, I haven't done them for a little while. I've taken a little bit of a break, but probably we'll get back into it soon. But it was kind of cathartic, just a creative space. But to your point, you can't scale visits. If you're incredibly productive, you see 30 or 40 patients in a day, which sounds like an enormous amount of patients, but some people do it. Yeah. That's still not scalable. You Correct. Can reach hundreds, thousands, tens of thousands, hundreds of thousands with good social media. Now, as I said, our goal is not to be big in New Zealand. But if you create a presence, hopefully it's one big enough to reach your community. But if it's not, your community, if you have a presence on there, can come looking for you. And so that's really critical, because even if the algorithms aren't feeding your content to the people that follow you, and they typically don't, unless there's some money thrown in, but if people say, you know what, let me jump on to, Dr. McDonald's Facebook or Instagram or whatever platform that you're on. And I think for anybody out there trying to think about, maybe we should get on social media, and you don't know which platform to get on, survey your patients, because that's where you want to go, where your patients are. Right. And we know there's typical age demographics that oftentimes will shape where people say they are. But, I joked about Facebook, and that might be a bit of an older demographic now. TikTok seems to be the rage that reaches a younger demographic. If you look at the data, the majority of people get to see YouTube. So, but my point being, that not just social media, but Alex, I'll take it one step further. Your website's really critical, right? A good website that does some representation of you, your voice, or the providers in your practice, that's a place people can go. So if they're hearing conflicting information about flu vaccine and we're heading into flu season, maybe they can't call you or don't want to leave a message, but they'd just like to see what are your thoughts on it? And if they can see updated information on your website, or, we have something called doctor's notes on our website. So we try and stay up with timely information, and it's searchable and it's indexed, and they can look up and see what we think about it. But again, they can further go onto social media and see videos, or sometimes, we were doing podcasting and webcasting. They could go there. We actually did multiple channels. And to the people out there who control the purse strings in these practices or in these hospitals, health systems, or integrated delivery networks, you might say that sounds kind of expensive. First off, I'll tell you, you don't need a production studio. I'm holding a smartphone in my hand, and pretty much anything we do in a production studio, a teenager in a smartphone can do. And that includes shooting video, editing video, podcasting, anything like that. But then you might say, well, that sounds like that's really costly. And I would say, for the cost of what you probably would pay for, a senior nurse, you could have somebody who's well-trained in communication to serve a large group of healthcare providers. And you might say, well, that, How's that help? They're not rooming patients. They're not administering medications. They're not taking vital signs. And I would say they can do multiple things you're trying to do right now, which is attract more patients. And most importantly, to help patients get to better evidence-based decisions. So your communications expert can help amplify your voice about why you feel it's important that people do a certain amount of physical activity every day, or that put sunscreen on, or eat more of a plant-based diet. That's pretty powerful stuff. And let me take it one step further, Alex. There are CFOs out there that are, or finance directors in these systems, and they're very concerned about things like value-based care and population health metrics. Guess what drives those kind of metrics? Communication.
Yep. Communication and behavior, right? And those are the two things that we can't necessarily control as well. We can counsel, but yeah, if we can get the communication out there, we can really drive those behaviors, which are really going to improve health.
Do you know who drives them though? Starbucks can get you to buy a double pump mocha latte for $12. Amazon can get you to use their services. Disney can get you to go on their cruises, and they don't even have trust. And they don't even have face-to-face time in an exam room, but they have hundreds of billions of dollars collectively that they put into communication to change behavior.
Yeah.
And yet we're the biggest sector in the economy is US healthcare. And we're not selling tires or insurance. We're literally trying to promote wellness or to recover from illness or disease.
All right, you got me convinced. So we need to do more communication here. So now, again, it's almost like we got you on here for a reason. Tell us more about some of your day job, if you will, or your night job. I don't know what time of day you do.
No, it's become my full. I work day and night. After 30 years in practice, I have now shifted full time to nonprofit healthcare communications work. So the Trusted Messenger Program is part of a larger nonprofit called Public Good Projects. And Alex and I have had the great fortune of getting a chance to meet PGP, Public Good Projects, and the work that they do. And so in this work, I am working with a variety of stakeholders, which include health systems and integrated delivery networks and hospitals and doctors and professional organizations, healthcare, including public health too, nursing organizations, pharmacy organizations. They're all currently saying that we know we need to be able to do better, but we feel like we're fighting upstream against all the noise that's out there. And what I want to point out to everybody here, and I think I said this earlier, is all the health fields are amazing in that they possess this asset, which is trust, innate trust in being a healthcare provider. Yet we squander it every day, because we're not trained in the things that you've learned and that I've learned. We don't use digital resources to support that trusted in-person relationship. And for those of you, again, that control the purse strings, there's a return on investment for this, just like Starbucks and Audi and any other company out there have recognized. So my day job now is working with all these stakeholders at large levels, like large webinars where I can talk to hundreds of people. We also have programs where we do train the trainers, and we might take 20 champions who are going to train hundreds more champions, and recognizing that trusted messengers really extend. Your front office staff may have more power than you. They know everybody that comes in. And if they don't believe in what you're saying, because I think I told you this story once where as a lactation consultant, we had somebody who was sitting out front going, I don't know about that. You can't tell how much the kid's getting and they could get dehydrated. Just give them a bottle of formula. Holy crap. Like if I'm in the back trying to say, hey, have you thought about breastfeeding? Let's talk about the benefits. Here's things that we can do if you have interest. And they would. But if they hear that from, somebody out front, maybe Gladys, who's been working at that seat for 20 years, they're like, well, I don't know. So the culture of your practice and getting everybody on the same page is critical, because we all have a role of trust to play in that practice. And that extends, by the way, to community health workers and faith-based organizations as well.
Yep. Yeah, absolutely. I think, we always think about, again, you mentioned value-based care, we mentioned sort of primary care, and again, one physician can only see so many patients. And I've had lots of people kind of talking about, okay, what's the next iteration of primary care? Like, how can we amplify that? We have this massive physician shortage. And I think this is the key piece. I think communication, collaborative, systematic, goal-directed communication, not just like random things and seeing what sticks out the wall, but being very strategic about how we communicate, where we communicate. And I think that's really the next iteration of primary care, which a lot of us are just not thinking about, unfortunately.
Yeah. And again, we're not trained, we're not resourced, and we're not supported. As a matter of fact, almost all healthcare providers, when they join a system, sign a contract that says don't get us in trouble using social media.
Right,
And
exactly.
the funny thing is that, right, that younger healthcare providers are completely comfortable using social media. But rather than leveraging that comfort and saying, let's train you how to use this as a professional, they're kind of scared away from it. Like, don't you get us in trouble? Like, okay, I won't be using it. Why not turn that on its head, like you said, and say, this is the healthcare provider of the 2025 plus period. And say, here's how we're going to work. We're going to train you on a regular recurring basis. We're going to test you on some best practices. We may even want you to do some, mock interviews and things like that, where you really kind of, or at least have them go through things that are more meaningful with one-to-one communication. I don't think that every healthcare provider has to have their own social media presence, but I do think every practice has to have at least one social media channel now that's relevant to their population. Because, we take an oath to do no harm, and there's laws about patient abandonment, Alex. But when we're not here, I truly believe, and I'm holding up my phone for those of you that can't see, if we're not there, we're basically saying we know our patients are going to go on there. And if we're not there, they're going to get information from someone that definitely may not have their best interests at heart. And don't forget, it's not just millennials and Gen Zs, but it's Xers and boomers that want their information where they want it, when they want it, and how they want it. That could be 2 a.m. breastfeeding your kid on the couch. It could be 7 p.m. on a toilet somewhere.
I think it's really important for people to think about where they get the information from, how they get their information. And when we have this sort of void of good, trusted messengers, and we'll just use social media as an example here, when there's a void and all these other things are just kind of garbage information is filling that void, truth doesn't rise to the surface, truth sinks to the bottom. And I think that's really important. And I often will tell patients, if it sounds quick and easy, it's probably not fully accurate, or it's probably missing some kind of context. And so I really think that, being present in all these spaces, whether it be in our clinics, whether it be in our social media, whether it be in our churches or our kids' soccer or our PTA or whatever communities that we are a part of as physicians, we are still physicians and a trusted messenger, and having those conversations and sharing those truths and pointing out when people are sharing or spreading inaccurate information, I think is really key. And it becomes more and more important in this day and age for us to bear that professional responsibility.
100% agree. I do want to go back to the fact that we know that healthcare providers are feeling immense burnout, and just
absolutely
so much is upon them, and they're like, oh my God, one more thing. But if I could say, if there could be a bit of a paradigm shift within healthcare in general, and I'm speaking to the healthcare environment out there, that if we become better communicators, if we use digital resources like you and I just mentioned, we could make visits more meaningful for both the healthcare provider and the patient, while also being more effective at dispelling some of the inaccurate information out there. And ultimately, again, we are measured on various population health value-based metrics. This is a great way to make sure that asthmatics are not just using their beta agonists, but are using controller medications appropriately. It's a great way to talk about cardiovascular health and, some simple behavioral changes we can do to lead healthier lives. But we can't scale up one visit at a time. We can leverage that trust again with these virtual resources. So it's about learning to be better communicators in person in the office and enhancing that trusted relationship with these virtual tools. And to your point, it's the scary, sensational, easy stuff that rises to the top. But patients want to hear from you, even at 2 a.m. But if we're not there to provide some connectivity, even if they mean they have to go to the website or check our social media sites, we're missing out.
Agreed. Well, I mean, this has been a phenomenal conversation. We could probably go on for hours, but we don't want to bore our listeners to death. Tell us real quick, kind of where can people listening learn more about the Trusted Messenger program, or get more involved, or get more training themselves?
Yeah, so we are literally out of the gates and running very fast. So the Trusted Messenger Program, TMP, is just about to be getting its website and social sites up. In the meantime, Public Good Projects, which I believe we can put a link to, does have a website where you'll be able to link to some of the work that we're already doing, since we're part of the larger nonprofit PGP. So we will be on social media channels. We will have the website for you. And hopefully would be thrilled to be able to talk to you. I had the great fortune of being able to be at the California Immunization Coalition, I think it was, just last year, and I'll be, looks like, out in California talking at the large public health meeting at Long Beach coming up this spring. So thrilled to be able to meet and engage people any way we can, both in person and virtually.
Wonderful. Yeah, we'll definitely put that in the show notes, and so look for those links in the show notes. Well, this has been such a phenomenal conversation. I want to leave us with my kind of 6 takeaways in this day and age, and information and disinformation and communication. And I'd love to get your brief thoughts on these. And my 6 takeaways: number 1, meet people where they are. Right, just figure out where people are and meet them at that level. Number 2 is, don't really allow anger and fear to drive you or to shame other people. We want to invite people in, not call people out, and share that information in a collaborative, constructive way. We need to tell our stories. We need to tell our patient stories. Trust is earned and demonstrated. And so we can't just assume it's going to be there. I think we have all worked for our whole careers to build that trust. And then lastly, top-down information doesn't work the way it used to. We need to kind of have these conversations individually and have that communication grow from the ground up. And then lastly, I encourage everyone to, like I said before, just keep speaking up, keep sharing your perspective and your truth, because I think that's really critical. So those are my 6 takeaways for people listening today.
Yeah, I love every one of those. I'll add to it. We will all do better and be better healthcare providers if we're better communicators.
Yeah.
That as a result of being a better communicator, when you walk into any exam room or prepare to have a discussion with any patient, I think you will feel empowered by being a better communicator. And more importantly, you can help empower your patients to have a more powerful or meaningful conversation. And to your point, I think we find ourselves where we are today because we haven't necessarily built that bigger tent that we need to build. And I think we need to really appeal to a broader spectrum of people who it's easy to rally around better health.
Yeah.
Nobody doesn't want, their kids to not, we want our kids to be healthy. We want to be healthy. And if we can get rid of the noise and don't forget, build and enhance the trust that we have with better communication, we can take healthcare to another level.
Yeah, I completely agree. That is a wonderful note to end on. So, Todd, thank you so much for joining us and sharing your expertise. And let's continue the work together.
Thanks so much. It's been an honor to talk to you and to talk to all of you out there.
And thanks for all of you out there listening. We'll see you guys soon.
Wow. Huge thanks to Drs. McDonald and Wolynn for bringing this conversation to the Family Docs podcast. You can really tell these two are media experts and have incredible experience and perspective on being champions for their patients. Until next time, this is your favorite family physician, Dr. Rob Assibey. Please see the show notes and visit us online at www.familydocs.org. Thank you all, and until next time, this is your favorite family physician, Dr. Rob Assibey. This podcast was created, produced, and recorded by the California Academy of Family Physicians. The views and opinions expressed in this program are those of the speakers and do not necessarily reflect the views or positions of any entities they represent or the California Academy of Family Physicians.